Now starting the bulletin with some breaking news and a shocking as well when a government doctor was stabbed 7 times at a Chennai hospital this morning by a 25-year-old youth who posed as an employee. The doctor is also a heart patient and suffered injuries to his upper chest. He is in the ICU but is in stable conditions as per sources. The young man who stabbed him has been arrested. The attack took place in the OPD after he suspected the doctor had prescribed incorrect medication. Tamil Nadu Health Minister visited the spot and assured that a speedy justice will be given, whereas protests are being carried out in Chennai over doctor stabbing, raising alarms over how the insecure environment persists in the country, in the hospitals. First, let's take a look at what Tamil Nadu Deputy Chief Minister Udhayanidhi Stalin had to say.
What appears to be the thing?
It is an accident. The patient's mother has been infected with cancer. She's a cancer patient. She has been taking treatment here for the last 6 months. After here, he has shifted his mother to a private hospital. There, the doctors have misguided him, so he's come back. He's come back here.
Any steps to be taken to enhance security?
He's had a conversation with the Dr. Balaji for half an hour, and this incident has happened. This is definitely.
Any steps to be taken now?
The concerned person has been arrested. The legal action will be taken. We have assured the safety of all the doctors.
Is it a kind of a security lapse in any way?
No, he's been coming here for the last 6 months.
Right.
There's no security lapse. We cannot be frisking everybody who's coming here.
And would you be tightening security now?
We'll discuss with the CM or Honorable Minister is having a discussion with all the Doctors Association at around 3 o'clock.
My colleague Sam Daniel is joining me. Sam, what are the protesters saying who are demanding, as what we heard before you were speaking to several protesting government doctors, they were saying there is no proper security arrangements at the hospital. Take us through the highlights of their demands.
Aditi, we come to you from the Kalangar Centenary Super Speciality Hospital where Dr. Balaji was stabbed this morning. And as we speak now, doctors say his condition is stable. He is at the ICU. And outside the hospital, doctors and nurses, they are actually on a kind of a protest. And at 4 o'clock, there would be a formal meeting. They have given a 13-point demand to the government, including strengthening security at the hospital. Joining us now, Dr. Anton. Thank you very much. Doctor, we're sorry about the attack on Dr. Balaji. What are your key demands now?
Sir, we request adequate security persons. We request capital punishment for the accused. We request installation of CCTV and functioning CCTV in all government hospitals. And we request adequate number of doctors and paramedical staffs in government hospital premises as per the patient-doctor ratio rather than NMC recommendation, so that the patient care will be taken in a better aspects.
Would you call this a clear case of security lapse, what happened today?
100% this is a clear-cut lapse of the security. There is no functioning CCTV. There is no scanning of our metal detectors. There is no police person inside the premises. So this is a high volume, high number of patients coming places, this hospital premises. So this needs more security person.
This is relatively new, what the government claims to be a state-of-art hospital. Are you sure the CCTVs here don't work?
I think I don't have any evidence there is a functioning CCTV. I think there is a CCTV is not functioning here.
What's the sentiment among the doctors after this attack?
So doctors are in a very painful situation. We request the common public, doctors also a patient. Doctors also can become a patient. Doctors also a one among the public. They are your own brothers and sisters. The attack on a doctor is the loss for the society. It is attacking your own brothers and sisters. So don't see a doctor as like a culprit, what the media, politicians and bureaucrats projects. You can see so many friends or relations, doctors among your own contact circle. So seeing a doctor as a culprit and projecting a doctor as a culprit in a media and social media should be stopped or should be banned.
Lastly, doctor, as we speak, the suspect's mother had taken treatment many months ago, not now. She's no longer a patient now. How was it possible for him to enter the hospital without, when he's not an attender officially?
See, in government premises, in any government premises, other than RBI or other than High Court, any premises, anybody can go inside and come. That's how the
Wristband kind of restriction, identifying who's a patient, who's a visitor.
there is no such thing like a wristband identification for the patient. Attenders are there anywhere in the government hospitals.
Thank you so much, doctor. Again, I'm sorry about the attack on Dr. Balaji. And this evening, there would be a formal meeting between the Tamil Nadu Government Doctors Association and the Tamil Nadu Government Health Secretary and other senior officers. Based on the outcome, doctors say they would decide their next course of action. As we speak now, doctors at this hospital alone have suspended electives.
Absolutely, a major unfortunate news coming in from Tamil Nadu. Thank you so much, Sam, for speaking to the protesters who are demanding better security arrangements at the hospital. Now, I am also being joined by Dr. Rajiv Jadan, who is the co-chairman of National Indian Medical Association COVID Task Force. Dr. Rajiv, thank you so much for speaking to us. Dr. Rajiv, this gruesome incident again brings back those memories of doctors' protests over what happened in Bengal when a doctor was brutally raped and murdered.
Yes, it's been only 3 months since the incident in Kolkata, and what happened to Dr. Balaji today is completely unacceptable and cannot be excused under any pretext. So there is no excuse or justification for such an event. Now, from the doctors' fraternity side, we have always maintained that the healthcare profession in general and doctors in particular are at high risk of injury from patients' bystanders and patients themselves. Injury can occur either as a result of violence, which can be either premeditated, which is planned, or spontaneous. Spontaneous violence sometimes occurs after a conversation, just like what happens on the road when two vehicles have a slight brush up and the two people start arguing, it escalates into violence. Now, we are not clear what happened in Chennai today, but it appears the assailant was carrying a significant weapon, so it's possible that this is premeditated. And if it is premeditated, the outcomes are more severe as what happened in Kolkata. But the vast majority of incidents of violence against doctors are verbal or physical assault, are spontaneous and can happen in crowded settings when there is lack of security personnel, there is lack of crowd control. There is something called triaging, where not everyone, as the Dr. Anton earlier said, you can't have everyone walk into a healthcare premise because there has to be crowd control. Patients need to be triaged, and the doctors and nurses and others must be given a safe place to work so that they can attend critically ill patients. And sometimes when the patient's condition does not improve or deteriorates, that does not mean that the treatment was wrong. And that is something the society needs to understand. And if the treatment was wrong, there are civil and professional forums for such facts to be looked into, and violence is definitely not an answer.
Absolutely, violence is not the answer. Dr. Rajiv, do you think that before a solution is found out from central government side, or a major overhaul is done, states should take immediate actions? I mean, right now we saw how the man was carrying a dagger inside the hospital. He entered and then this tragedy took place. Do you think, immediate action should be taken up by state governments as well?
Unfortunately, healthcare security has been looked at quite lightly by governments across the country, and that is no secret. That is one of the reasons why we saw nationwide agitations after the Kolkata incident. Now, people may think that these incidents are rare, but let me tell you something. A rare incident like this is a sign or a symptom of a larger picture which carries gross deficiencies. In fact, that is Dr. Deepa, myself, Dr. Rashmi and others, authored the largest study in India on doctors' safety at the workplace. It was published just in October. We demonstrated that 11% of doctors feel completely unsafe at work. 24% of doctors felt unsafe. half the doctors do not even have a duty room at night. And those doctors who get a duty room do not even get a toilet 1/3 of the time. And there are no CCTVs, there are no security personnel worth speaking of. And if they're present, it's typically old, retired, frail individuals who the doctors complain are often the first to take flight when such an incident happens. So hospitals need to be declared as safe zones. Remember, no matter how aggrieved you are, you did not create violence in an airport. And why is that? Because everybody knows that you can't create violence in an airport. You must go and file a complaint. Likewise, healthcare facilities must be declared safe zones, and a central act must come in place unifying healthcare systems across the country. And it is not just the state governments that need to work.
Dr. Rajiv, if you don't mind, can you list down, 5 quick and easy solutions that hospitals can do on their part? It has been a long debate that government should do this or that. Then government says we don't have infrastructure, we don't have resources. Let's, look at a pragmatic approach towards this problem. What should hospitals do right now? Should they install more, detectors, weapon detectors, metal detectors? Should they employ more people for security arrangements?
Yes, in our study, we asked the doctors themselves who are on the front line for what they think are the solutions. So here are the top solutions. One, provide adequate security personnel who matter. They should look and act like professional security personnel. I already mentioned that earlier.
Right.
The second is crowd control. It's quite common to see drunk bystanders enter in crowds into casualty and threaten nurses and doctors verbally and sometimes physically abusing them.
Absolutely.
That cannot be allowed to happen in any healthcare establishment, private or public. The third will be install professionally managed CCTV monitoring system so that they are not only monitored, but there is preventive action taken as soon as there is any sign of trouble. And the fourth will be a central act that protects all healthcare professionals. That's not just doctors, but let me admit this, doctors are seen as the face of the medical profession and are frequently on the front line. And that is the reason why they are the top targets in such acts of violence.
Absolutely.
So these are the top recommendations from the study.
Well, thank you so much, Dr. Rajiv, for joining us and giving those quick solutions for what we can do on our part. Thank you so much, Dr. Rajiv, for joining us.